Hello everyone. Let's begin with the next module in respiratory system. The next module is on pneumoconiosis. Pneumoconiosis, that is the group of occupational lung diseases. Occupational lung diseases. See, this topic is a bit dry, okay? But for your exam, you may get factual questions from this topic. So, simple to score marks, straightforward questions. It's very tough to complicate a topic like this. So, it is a very straightforward question that you're going to get for your exam. All you have got to do is to memorize this well, okay? So, let's begin with this topic. Okay, first of all, let's try to understand what is this term pneumoconiosis. Okay, what is it? See, this pneumoconiosis refers to a group of chronic fibrosing diseases. A group of chronic fibrosing diseases, which means it is not a single disorder. It is actually in group of disorders. There are various pneumoconiosis, and this group of fibrosing disorders occurs because of exposure to either inorganic or organic dust. Okay, so what is it? There is exposure to either some inorganic material like a mineral or maybe some organic material, and as a result of exposure to this particular dust, there occurs some changes, some fibrosing changes in your lungs, and it results in the pneumoconiosis. Okay, now remember that each and every type of organic and inorganic dust does not produce pneumoconiosis. Okay, it definitely depends on various properties of your dust particle, like what is the size of the dust particle, and it depends on the solubility. Okay, it depends on the what form it is existing in nature. It depends on lots of things. So for example, just to cite an example, for a particulate matter or a dust particle to produce a pneumoconiosis, the size range should be approximately 1 to 5 micrometer. Okay, size range should be approximately 1 to 5 micrometer, so that it should be sufficiently small that it can reach up to the terminal airways, the alveoli, so as to elicit this fibrosing reaction. Okay, all right. So let's now discuss the individual pneumoconiosis. Remember, the list is exhaustive, but we will be discussing the ones which are very important for your exams. So let's start with asbestosis. Okay, let's start with asbestosis. So as the term indicates, this is related to what? This is related to asbestos exposure. So this pneumoconiosis is related to asbestos exposure. But one point you have got to keep in mind, all type of asbestos exposure will not produce asbestosis, because see, asbestos in general can have two forms. Okay, in general can have two forms. One is your serpentine form. One is serpentine form. Okay, and the second is amphibole form. Serpentine form and amphibole form, these are the two types of asbestos. And this serpentine form is also referred to as the chrysotile form. Okay, chrysotile form. Whereas your amphibole form again can be of two types. One is your crocodolite and other is amosite. Okay, nothing a bit of tongue twisters, but these are the types of asbestos. Now one point I have to tell you is that this is chrysotile, okay, not chrysolite. The other ones is crocodolite and amosite, but this one is a tile because it is wrongly given in Harrison. Harrison mentions it as chrysolite form. Okay, so there is a mistake there. Robbins gives it correctly. It is actually the chrysotile form. So these are the forms in which asbestos exist in nature. And tell me who is going to be your villain. Is it going to be your serpentine or amphibole form? Any guesses? See, it is your amphibole form. Okay, your amphibole form, that is your villain. Though only 10% of asbestos exist in the amphibole form, 90% is in serpentine, but this 10% is the one that is problematic and can result in asbestosis. Okay, so this is your troublemaker, the amphibole form, that is your crocodolite and your amosite. Okay, all right. So you know who is the villain. Okay, now let's see how do the clinical manifestations happen. So coming to the clinical features of asbestosis. First and foremost, let me tell you one thing. Asbestosis develops only after a long time exposure to this asbestos. You cannot have an asbestos exposure for around 1 or 2 weeks and the next day the patient develops symptoms. No, it's not like that. Usually it takes at least, remember, at least, it can be more than that, at least 10 years from the time of exposure to the clinical symptoms to develop. Okay, at least 10 years. So now let's see what are the manifestations of the asbestosis. There are varied manifestations for asbestosis, and the manifestations include, you can have pleural plaques, you can have pleural plaques, you can have pleural effusions, okay. You can have diffuse interstitial fibrosis, you can have lung malignancy developing, CA lung, as well as you can have mesothelioma. Okay, mesothelioma. So these are the various manifestations of what? Asbestosis. Okay. So just a few important points. First of all, pleural plaques. So pleural plaques means they usually occur in the form of thickenings of the pleura, and this pleural plaques, okay, the pleural plaques may be a result of the fibrosis of your pleura, plus there may also be calcification. Okay, there may also be calcification involving your pleura. Okay, that is what you call your pleural plaques. Okay, and the next manifestation after pleural plaques is pleural effusion. Okay, pleural effusion. So pleural effusion in associated with asbestosis is again a exudative effusion. Okay, it is a exudative effusion, and sometimes it may be serous effusion, but sometimes it may be bloody effusion. Okay, but it is an exudate. Okay, and this type of effusion is also known to contain eosinophils. Okay, so while I discussed pleural effusion, I was telling you that certain types of effusions contain eosinophils. Okay, maybe as a part of drugs like nitrofurantoin, or it may be part of pulmonary infarctions, or it may be a part of say a parasitic infection like Paragonimus westermanni. So even your the asbestos related pleural effusion also may show eosinophils in the pleural fluid. Okay, so you may have eosinophils in the pleural fluid. All right. So out of these, the common one, the most common one is the pleural plaque. Okay, which is very common. And then see, I told you it can, it can affect the pleura and can produce a pleural plaque and pleural effusion. And what about the lung? See, the lung manifestation of asbestosis is predominantly an interstitial involvement. And what do you get? You will get a diffuse interstitial fibrosis. Okay, a diffuse interstitial fibrosis is what you get. And very important, the fibrosis associated with asbestosis is usually bilateral, okay, and it is common in the lower zones of the lungs. Okay, this is very, very important. Okay, it is common in the lower zones because we will compare it with another pneumoconiosis like silicosis, where it is predominantly the upper zones. So this is bilateral and involving the lower zone. Okay, diffuse interstitial fibrosis. Now it can also lead on to malignancy like CA lung. You might have either the adenocarcinoma or the squamous variety. And there is one interesting point that you have got to understand. That is the asbestos exposure, if it is occurring in someone who is a smoker also, there is a higher risk, okay, or additive, more than additive risk of developing a lung carcinoma. Why it is so is because, see, once somebody is exposed to asbestos, this asbestos will absorb, okay, absorb the toxic chemicals present in the tobacco smoke, because of which, your airways, the alveoli, everything will be exposed to these toxic chemicals for a longer period because of the adsorption property of your asbestos. So whenever you have a asbestos exposure occurring in a smoker, then it is a very high risk of developing a CA lung. Okay, that you have got to keep in mind. And another thing is about mesothelioma. Mesothelioma can occur because of exposure. Now, mesothelioma can either be a pleural mesothelioma or it can be a peritoneal mesothelioma. So, either a pleural or a peritoneal mesothelioma can occur because of asbestos exposure. And remember, unlike the cigarette smoking, which was associated with the additive effect, the mesothelioma is not having such an effect. Okay. All right. So these are the important manifestations, okay, of asbestos exposure. So tell me, how will the patient present? So the commonest presenting feature would be of dyspnea on exertion. Okay, dyspnea on exertion would be the commonest clinical manifestation. And once the fibrosis, the interstitial fibrosis proceeds, you might have dyspnea at rest as well. Okay, but usually it is dyspnea on exertion that you have got to keep in mind. Now, the patient can have other manifestations as well. Suppose if the patient goes on to develop a CA lung, he can have a cough, hemoptysis, weight loss. So other manifestations can be there. But with respect to the fibrosis of the interstitium, it is a dyspnea on exertion. And when you do a pulmonary function test in this particular individual, especially because of the interstitial fibrosis, you can have a restrictive pattern. Okay, you can have a restrictive pattern. Okay, all right. Now let's just see a few x-rays as well. Okay, let's focus on the x-rays because sometimes in your exam they may give you an image based question. Okay, though this is a dry factual topic, they may give you an image based question. The first image I have taken directly from Harrison. So what do you see here? See, what you see bilaterally is presence of all these pleural plaques. Okay, you can see which are appearing very bright. Okay, they are actually the calcified plaques, pleural plaques that occur associated with asbestosis. Okay, and again another X-ray that is showing the plaques, the pleural plaques. You can see they're slightly more larger plaques compared to the first one. And there is another spotter which may be asked for you. Okay, are you able to see that there are so much of plaques? And you see these are very large plaques, correct? No, these are very large plaques. Okay, and some of them are having, a leaf structure. You agree with me? Having a structure like a leaf. Okay, so this sign, okay, this radiological sign is referred to as the holly leaf sign. Okay, it is referred to as the holly leaf sign. That is when you have extensive pleural plaques. Okay, now if you ask me, is there any role for your CT thorax, the HRCT? Yes, when you do a HRCT thorax, there are varied manifestations that can occur. Okay, so either you can have, say, you can have ground glass opacities. Okay, you may have a reticular pattern. Okay, you may have reticular pattern. You may have honeycombing. Okay, so it is not any specific pattern. Okay, so honeycombing. Okay, so varied CT manifestations can be there. You can even have your plaques which can be very well demonstrated. So these are the HRCT findings as well. Now just one pathology MCQ which I am sure that you might be knowing. What are the two bodies associated with asbestosis? See, I've taken this picture directly from Robbins. Can you tell me what is the name of this? This is called your asbestos bodies. Okay, this is called your asbestos bodies. And in addition to asbestos bodies, you may also get ferruginous bodies. Ferruginous bodies in this condition. Okay, so summing up, this is asbestosis. It's occurring because of exposure to the amphibole type of asbestos, resulting in varied manifestations that occur after a long latent period, at least 10 years. But see, for a CA lung, it might take more than 15 years. Sometimes, say it said that it is taking roughly around 15 to 19 years for a CA lung to develop. And mesothelioma might take again another 30 to 40 years after exposure. So a long period is there, at least 10 years of exposure. And you must know what are the varied manifestations. Okay, the ones I told: pleural plaques, pleural effusion, diffuse interstitial fibrosis, CA lung, mesothelioma. Very, very important. Okay, so I think you have got a reasonably good idea about asbestosis. Okay. All right, so now we will move on to the next entity after asbestosis, and that is going to be your silicosis. So let's start with silicosis. Silicosis occurs because of exposure to free silica. Okay, free silica, which is your silicon dioxide. Okay, silicon dioxide, which has again two forms are there for this free silica or silicon dioxide. One is your amorphous form, and you have got a crystalline form. Okay, amorphous form, and it has got a crystalline form. And this crystalline form is the one which is likely to produce more manifestations of silicosis. Okay, so let's try to see how silicosis manifests. Silicosis also, like asbestosis, would require a longer period from the time of exposure to the development of silicosis manifestation. But there is a slight difference, that is silicosis can have two type of presentations. You can have a acute silicosis, or you may have a chronic silicosis. Now when I say acute silicosis, don't mistake it like somebody is being exposed to silica, the next day he develops. That is not an acute presentation. Acute silicosis also, it requires at least at least 10 months. It requires 10 months for development of symptoms, whereas chronic silicosis it requires almost 15 years. Okay, long exposure. Okay, all right. So first let's see how does acute silicosis present. Just a couple of points. See, acute silicosis. Okay, acute silicosis. This presentation is clinically and pathologically very similar to the presentation of pulmonary alveolar proteinosis. Pulmonary alveolar proteinosis. So patient may have breathlessness. Often dyspnea will be the presenting symptom. And in acute silicosis also, I already told you, it requires a 10-month exposure period. So this can affect your lungs, especially it interferes with the function of your macrophages also. And subsequently, there is a lung damage as well because of activation of certain reactive oxygen species. There is subsequent lung damage. And remember, the CT picture that you would see in case of acute silicosis is this one, which again is given in your Harrison, the same picture I have taken. Now, this pattern of acute silicosis, where you have ground glassing, okay, where you have ground glassing, plus, you have associated with the ground glassing, thickened interlobar lobular and intralobular septa. Okay, thickened interlobular and intralobular septa, and this pattern is referred to as a crazy pavement pattern. Crazy pavement pattern. Okay, crazy pavement pattern, acute silicosis, ground glassing plus. Are you able to see the ground glassing? And along with that, you can see the thickened septa as well. Okay, that is creating this pattern called the crazy pavement pattern. So chronic silicosis. Now let's come to chronic silicosis. See, chronic silicosis usually occurs in people who are working in the stone cutting industry. Okay, the stone cutting industry, the sand blasting industry, okay, as well as the miners. Okay, so these are the occupations where you get your silicosis. Okay, and regarding asbestosis, in case they ask what is the occupation related to asbestosis, so remember that asbestosis is related to the following occupations, that is your mining industry, okay, milling industry, and the textile industries, and the various cement manufacturing industries. Okay, so all these are the ones which may result in asbestos exposure. Okay, just keep that also in mind. So coming back, the silicosis. Okay, the silicosis, what are the ways in which silicosis can present? Silicosis can present either in the form of simple silicosis, complicated silicosis, okay, simple silicosis and complicated silicosis. Now, when I say simple silicosis, it means that the patient would have some nodules, okay, he would have some nodules in his lung which are usually less than 1 centimeter. Okay, and in such individuals with simple silicosis, although you have these very small nodules, the lung function might be normal. So there is no impairment of your lung function. It is when you do a pulmonary function test also, it looks relatively normal. Whereas in case of complicated silicosis, what happens is that you get nodules which are larger, that is more than 1 centimeter, and there will be impaired lung function. And this complicated silicosis, it can actually progress also, resulting in a condition which is associated with significant fibrosis, which is called a progressive massive fibrosis. Progressive massive fibrosis, you can abbreviate it as PMF. Progressive massive fibrosis. Very clear? Okay, so that is your simple silicosis and complicated silicosis. And another interesting fact to note is that, see, if somebody has been exposed to silica, even if he is further not exposed to that particular exposure, even then he might go on to develop these symptoms. Okay, so even when the exposure has stopped, the disease can progress. Okay, that is also something you have got to keep in mind. So simple silicosis and complicated silicosis. So this is a X-ray of a complicated silicosis. You can see the larger nodules. Okay, larger nodules you can see. And see this silicosis, the nodules, especially when somebody develops a complicated nodule, you may also have associated a hilar lymphadenopathy. Okay, hilar lymphadenopathy, or maybe some mediastinal lymphadenopathy. And the lymph nodes can undergo calcification, and this calcification will be more towards the periphery, and this is referred to as the eggshell calcification. Eggshell calcification. Are you able to see here? Okay, you are able to see the calcifications. Okay, it's referred to as the eggshell calcification, as it is predominantly the calcification is in the periphery. Okay, so you can have a lymph node enlargement. And also remember another point, the chronic silicosis can again predispose to development of tuberculosis. Okay, so whenever a silicosis happens, and sometimes the patient may go on to develop a cavity and subsequent tuberculosis, that is referred to as a silicotuberculosis. Silicotuberculosis. Okay. Now, the silica is actually a potential carcinogen as well. But again, though it is a potential carcinogen, we are still not very definite on the association between silica and malignancy. But remember, in Harrison, they mentioned that silica is a potential lung carcinogen. But lots of recent articles actually say that this association between silica and lung malignancy is not very definite. So just keep that in mind. Okay. So why this silicosis, causes tuberculosis is another interesting fact, is because this interferes with the function, that is your silica interferes with the function of your pulmonary alveolar macrophages. And when I discussed tuberculosis, I already told you, if you have listened to that module, I've already told you that the pulmonary alveolar macrophages form an important part of your defense against Mycobacterium tuberculosis. So that is very important. So that is why it predisposes to development of tuberculosis. Okay, silicosis can predispose to development of tuberculosis. Okay, very clear. So we have seen asbestosis, we have seen silicosis. So silicosis also, again, remember that the clinical presentation would be with a dyspnea on exertion. Patient would have some crepitation. But when you take a CT thorax, or maybe you take a X-ray, the fibrotic changes in silicosis are predominantly towards the upper zone. Okay, fibrosis is predominantly towards the upper zone, in contrast to your, say, asbestosis, which is having a lower zone fibrosis. So that is one difference that you should keep in mind. Okay, so otherwise the presentation is very similar. Okay, all right, but remember, it does not have any association with a mesothelioma or a pleural effusion or a pleural plaque. All right, so after silicosis, let's move to the next entity, coal workers pneumoconiosis. Coal workers pneumoconiosis. Okay, coal workers pneumoconiosis, again, the occupation that is related to this entity is that in coal miners. Okay, just a couple of points to understand in coal workers pneumoconiosis as in silicosis. It can present with simple coal workers pneumoconiosis, complicated coal workers pneumoconiosis, and just like your silicosis here, you will have nodules less than 1 centimeter. Complicated means you will have nodules more than 1 centimeter, and like in silicosis, this can progress to progressive massive fibrosis, that is your PMF. Okay, so again the clinical presentation is again very similar. You will have dyspnea on exertion, pulmonary function test would show some restrictive pattern. And another point that you have got to know is that sometimes you may have an obstructive pattern also, rarely, coal workers pneumoconiosis, but usually it is the restrictive pattern. Now this coal workers pneumoconiosis is also referred to as the black lung. Okay, I'll just show you an autopsy appearance. Okay, you see here, this is a stage of simple coal workers pneumoconiosis. You can see all these black colors, correct? No, so there are small nodules, whereas this one is a complicated coal workers pneumoconiosis, which has progressed to the stage of PMF. Okay, so this is the one which is actually your black lung. Okay, which is actually your black lung coal workers pneumoconiosis. Okay, again very important. Now other than these, these are the most important ones. Other than these, you have other occupational exposures as well. I'll just show you this table in Harrison, where you see it is a this is actually a table in Harrison summarizing the various occupational lung diseases. See, asbestos we have seen, silicosis we have seen, the coal workers pneumoconiosis we have seen. Remember, most of the questions will be from these three, which we have discussed. Okay, and another point that you have got to know is maybe you can remember two more questions. Okay, one is among the inorganic dust itself, that is your berylliosis. Berylliosis is one disease which can produce either an acute pneumonitis. Okay, it can have an acute pneumonitis type of presentation, but it can have a chronic presentation, which can it is basically it has a chronic variety, a chronic granulomatous disease, and the presentation can very well mimic your sarcoidosis. Okay, it can mimic sarcoidosis. So that is one point you have got to know with berylliosis, which occurs because of beryllium exposure. And a favorite question which is often repeated is about the organic dust, is about cotton dust. The exposure to cotton dust can produce byssinosis. Exposure to cotton dust can produce byssinosis, which is an asthma-like illness. Okay, where you have some fever, some chest tightness, breathlessness. And this occurs in those who are working in the cotton factories. And usually this is also referred to as a Monday chest tightness. Byssinosis is also referred to as a Monday chest tightness, because it usually occurs in the first day of the week. That is why this byssinosis is a Monday chest tightness. So just that factual MCQ I've got to know. The others, you have the various metals producing among the inorganic and maybe some grain dust, but you are not going to get questions from that. Mainly it is silicosis and asbestosis and maybe coal workers pneumoconiosis also. So just to summarize, remember, a group of disorders, exposure to inorganic or organic dust resulting in some fibrosis, the most important ones being asbestosis, silicosis, and also coal workers pneumoconiosis. All right, simple topic.